السلام
Assalamu
عليكم.
alaikum wa rahmatullah wa barakatuh. Hello everyone and welcome to our webinar. My name is Noor Al-Madaj and I am an occupational therapist from Kuwait specialized in neonate and early intervention. And I'm the founder of this group, Occupational Therapy Support Group and Resources. So today's webinar titled with How Trauma Impact Negatively Mental Health and Functionality, How to Help, presented by OT Zainab alkhalaf. OT Zainab alkhalaf with 13 years of experience. She has master's degree in advanced professional practice in OT. She's the lead of Rehabilitation Academy to empower community and professional. Hello and welcome, Zainab.
Thank you so much, Nora. Thank you for this opportunity. Assalamu alaikum jami'an and good evening, everyone. So as Nora has mentioned, today our topic will be how trauma impacts negatively mental health and functionality, both of them, since both of them are really connected to each other. And from us as an occupational therapist, how to help. And I would highlight some points, although it might be showing that it's more of superficial and it's more of in the introductory presentation. But I don't mind that we extend it to more details in future presentations. And I haven't supported my presentation with any studies or any literature or evidence-based. Those are the knowledge that I know from my daily practice. And again, this is more of an introductory. I'm more than happy to do part 2 as an evidence-based trauma rehabilitation or trauma and occupational therapy. So just a second, I'm trying. Okay. So as an aim for this presentation is to introduce the impact of trauma on the brain. And since it would impact the brain, that will cause some issues with the functionality, if it's mentally or physically, and the feeling of well-being. So this introduction will be to understand what's the trauma, how do we interpret the trauma, and what happens to the human brain, and including for sure the stages and the types of a trauma. And this is really important to understand how the client or the individual are expressing their feelings and how to provide the right support in each stage. And finally, it will be like different type of intervention or modalities that we could use as an occupational therapy management with the trauma. And I would highlight some of them now, and I will expand them later in the slides. We'll talk about the attachment, creating active routine, helping the individual how to express their feeling. And we had that also discussion in the group recently about how each individual or each therapist would use different way to let the client express their feelings. There is no right or wrong, more just about individuals. What's work with this individual might not work with another one. Also, I would think about, we'll talk about the social support, sensory stimulation, how the sensory stimulation might help any person with the trauma. I'm gonna talk briefly about the amputation management, and I'm gonna try to find the booklet that I have translated. Well, it was created between one of my colleagues previously, and I have translated from English to Arabic. And I'm gonna try to find it and prepare it to provide to the group. In addition, I would highlight the importance of culture in the recovery and the greatness of the culture, and I would say the Middle Eastern, how to be appreciating the culture of Middle East and being whether Islamic or Arab. And this is rarely to be highlighted or to be empowered. And in addition, the mindfulness and the breathing. So when it comes to the definition of a trauma, so there are different type of definitions. So it depends on the incident that happens. So some literatures, they have identified as respond to a deep de-stressing. De-stressing in a way that the person, when they face certain situation, they start to feel stressed. So it's a huge stress, I would say, and it's big. From my perspective, okay, I have more of identify it, make it and simplify it to facing situation that causes the loss of safety, especially like when we think about the mental health, most of it is loss of feeling of safety or being disattached. But overall, we have to think it's about it as an incident of loss, whether it's physically or mentally. And I have put it as an incident of loss. We will think about the amputation. We will think about losing something physical, and we are not expecting it to lose it. Also, in addition, even mentally, and it will come to the feelings and to the safety. So again, like the definition of a trauma, I will go with the incident of loss, any type, and it's unexpected. And sometimes it's higher, or the situation is a way higher than my expectation. Since our brain or the human brain is limited to the knowledge, to the exposure, to the experience that they are exposed to. When we come to the types of trauma, there are, so far what I have came across in the literature, there are 3 types of trauma. There is the acute trauma that happens in one situation, a single stress. Sometimes it happens even in our daily life, we might not notice it. It's very minimal, I would say, or minor. And that's when I would say some of the literatures, they say about pediatric patient, not to overstimulate them because that might cause them a trauma. We will hear a lot about this terminology when they say about a trauma with kids. Don't shout at them, they might have a trauma. So they are simple, and it might be even short, I would say, period of time. And there is the chronic, which is the repeated, prolonged exposure, continuous exposure. And there is a complex, which is the highest. Okay, so these are the 3 that I came across so far. The stages are more important to highlight and to think about. And these stages are really important to consider, not only, I would say, with people who are facing trauma with wars, but also with the patient and families who are recently having medical diagnosis. There is always, they come across the first stage, which is the denial stage. They don't believe what's happening to them. They are expecting that there might be a treatment, there might be a method for them to restore as same as, I would say, whether health or situation, whether it's health or environmental, feelings, societal. So they are believing that it's a lie, or it's like, it's temporarily. I'm sure that I will be back to the previous stage, and I'm sure that there is something mistaken about the news that I'm facing or that I'm seeing. And then there is the anger, and those expressions being because that the person start to defend themselves. And this is really, it has to be understandable through any therapist when they come to deal with any client or individuals. I cannot say patient because sometimes they are not really a patient, more than a person who is in need, to sometimes have more of active listening. Active listening is really helpful to give, like allowing that person to communicate, or even sometimes the silence between the therapist and the patient can be a part of communication. So understanding the anger, understanding their feeling is really important. In stage 3, they start to bargain about how about if I do this method, would it be cured? How about if I go this certain place, would I get treatment? Would I be healed? And then they are entering to stage 4, where is the depression. Okay, they feel very low, and they feel that it's hopeless, that all the struggle that they are facing putting them down. After this stage, and this is really important, not to let them for a long time to be in this stage. And this is our, this is one of the critical stages that we need to monitor. We could even involve the client in certain activity. It might not be direct treatment or direct therapy for them, sometimes even asking them to help others. Okay, ask them for some help, even if it's for a few seconds. Ask them for to help you sometime to express or give ask them about their opinion about something different. And then finally about the acceptance and telling them how to move on. There is no point now to waste time on the just emotion. And this is one of the points that dragged my attention during my practice in the clinic. As for us, what we see in our culture, we hear quite a lot from time to time that I faced a lot of struggles when I was young. I was different people shouted at me, but nothing had happened to me. That we don't think about just the emotion. We have to move on to the next stage, which is what's the action, which is the most important part. We care about the feelings, but the most important part is moving towards the action. The feelings are there, but it won't help me to move. So sometimes I have just to give the courage to give the kick off a start just to help the client to move on to the next step. And sometimes we have to explain to the client about those stages, especially if they are understanding us, understand that we are talking to them, especially if they are, I would say, 5 years of age and above. Some of them, they might even show more maturity, and it depends on the cultural and in the environmental factors that might help them with this particular things that, okay, this is what happened, what to do next. When thinking about the impact of a trauma, in a few seconds, I will highlight what happens exactly in the brain when any person faces a trauma. So when we think about the trauma and about the sudden incident that happens, most of the time we see people after the trauma, they show some fatigue, they show the fearness, the anxiety, because again, there is disturbance in the self-regulation, there is a disturbance in the feeling of safety. And those components are very important when we think about the chemicals that are being produced in the brain. So we will sometimes we see changes in the appetite. Some of them, they might eat more. Some of them, they might cut the feeding, okay, which is really important to think about the feeding. And also I would highlight about the importance of the nutrition in our development, in our mode, in our functionality. Those are really, again, everything is connected to everything. When we say mental, physical, nutrition, exercise, sensory, everything is connected to everything. And when we think about also about the sleep pattern, and the quality of sleep is being impacted. And if this also the component of sleep is very important for any human being. Having disturbed sleeping pattern, the person won't have enough rest for their brain, for their body. They wake up the next day and they have they feel still the tiredness, the fatigue. So they feel that there is not enough energy for them to participate in any activity. So for them, the disturbance, and even that would affect their mood, which affects sometimes even the social life. For them, they don't feel that they want to meet anyone. They don't feel that they want to talk to anyone. So this is really important to think about it. And that would impact also the personality. When we think about the war that happens, and when we think about the victims, and when we think about sometimes we notice that there are changes in the personality. Losing the feeling of safety is the worst case scenario that happens to any human being. The losing, when we think about even losing the family, when we think about losing their kids, all of those, again, this is create the disattachment. This is create disturbance in the brain, disturbance in the mentality, disturbance in the physical, and that will lead to changes in the personality. And they will try to defend themselves as much as they can, because for them, I couldn't find anyone to help. Okay, and I have to help myself. I couldn't find anyone to defend me, so I have to defend myself. So as a reaction from the body towards the body. So, and this is one of the things that we see the changes in the personality. So, and this is now the point that I will be talking about is very important to think about it, okay, for us as a clinician. Despite the tools or the modalities that we will be using with our clients or individual, it's really important to understand and interpret in the right way what's happening in the body. Again, there is no right or wrong because each individual might respond differently. But especially with the trauma, and when we think there is one of the systems, okay, it works like a custom filtration. It's called the reticular activating system. And we could see it in the purple, light purple. This system with the shortcut, the RAS, this helps to filter different type of information, starting with the sensory information. So any type of information reached to the brain is considered sensory. And then from the RAS goes to the thalamus. So the RAS, if they receive the traumatic incident, they out of sudden filter and they stop. It's like a shock. We hear sometimes, or like we hear that there is a spinal shock, okay, when there is any spinal cord injury, okay, where there is a sudden loss of sensation and motor just to protect the spine, okay, because there is more of electrical messages traveling as a safety system in the body. Also in the brain, the RAS helps to filter if there is a huge information coming to the body, okay, they out of sudden stop. That when the messages stop, okay, that will cause corruption in the brain in producing certain neurotransmitters. The neurotransmitters are really important that help us to activate different type or different area of the brain. So when thinking about the neurotransmitters again, okay, and I would highlight more in the sensory stimulation part, okay, what type of neurotransmitter do we need that reach to the brain? And if there is corruption and disturbance in the production of neurotransmitters, when we think about the melatonin is responsible about our sleep. That will affect the serotonin, which is responsible for our feeling of well-being, appreciating whatever we have. And if the RAS, okay, this system, the activating system, not later on showing any process towards this huge information, that means it's still stuck. I should maybe have added the video of that child in Gaza, the child who woke up on the bomb, and I think, well, I cannot recall, to be honest, who was asking him, were you asleep? And he was like, his eyes was widely open. And to me, to be honest, I was waiting for his cry, and I was happy when the guy started to hug him, make him closer. He started to cry. I was happy to see the cry, because the cry means that he started to process it, to show it, to bring the path from any type of sensory that to perceive this information, okay, and moving through the pathway needed to the limbic system that would impact the emotions. It has to, I would say, to show it. They have to show it. They have to process it better than it's being kept in the brain, not processed, because that means there might be further and longer term of corruption in the brain and of the neurotransmitters. So this is what happens to the brain, and this is one of the pictures that I have seen, okay, and I quite like it because it shows how sometimes cause an issue in the neuroplasticity or the connection between the synapse, between the responses between the cells, Okay, and again, if there is this disturbance in the brain and this changes, that would change the brain functionality. If the brain functionality change, it will impact definitely the mental health and the physical health. When we say, and when they talk about the depression, when they talk about the anxiety, that means there is imbalance in the chemicals in the brain or in the body. We see quite often the people who have anxiety, when we ask them if they have pain, always try to ask any person if they have any anxiety or they are diagnosed with anxiety, and we see any symptoms of their anxiety, ask them about the abdominal pain. Why should we ask about the abdominal pain? Because there is the cortisol. Sometimes when we come to present any presentation towards the public and I'm not used to, I have the fear and I start to have this butterfly feeling in my abdomen. That means that the cortisol start to be gathered. If the cortisol start to be gathered, that would impact negatively the gastro system. And some of them, they might need the bathroom. Some people, they feel that they are like start to increase more and more. Always try to ask them about their feelings if there is any pain. If there is any pain without any injury, that means there is high possibility of imbalanced chemicals. Any mental health disorder means there is a problem in the balance of the chemicals in the body. And this is one of the important components that I always like to explain when it comes to sensory, when it comes to how we function in our daily life, how we behave in our daily life. Thinking about the chemicals is very important. Thinking about the neurotransmitters, that shows how the human body is really based on the chemicals. So for us as an occupational therapist, how to help those clients who are suffering from trauma? Okay, first of all, again, we have to think about the stages. Not all of them will be suitable for all the stages, okay? So each stage has to be dealt differently. So when it comes to sensory stimulation, and again, I'm not talking maybe about the integration right away. I'm thinking about just the sensory stimulation. It's just about having the roadmaps in the body going to the brain and back as an input and as an output. Why I care about sensory stimulation again? Because of the neurotransmitter, for example, and this is one of the things that I start with any type of cases, okay, apart from the ortho and the bone glass bone, I think it's called condition, the one that easily can break their bone. I always start with the massaging and massaging and massaging and massaging. With the infant, I always start with the massaging. With the sensory disorder, I start with the massaging. With the neurological condition, I start with the massaging, especially with pediatrics. Why I care so much about the massaging? Again, it helps, like, because especially when we massage or give deep pressure towards the joints, we all feel happy, that feel of relaxation feeling after receiving a hug, after someone is squeezing my hand, after receiving a massage. Why do we feel happy? Because any pressure that were like any deep pressure that the human body perceive, if it reaches to the brain stimulate one of the cells to produce the dopamine. The dopamine is one of the important neurotransmitters to help to facilitate the emotions. Also, the dopamine helps the human being to develop motor skills, including motor planning and motor coordination. And this is really important component when we think about the massaging. And again, it has to be deep massage. Some, I would say, therapists or like parents, when we give them, for example, the home program as a massaging, okay, when they come back after 1 month, and so when I ask them if there is any improvement and they tell me no, I would definitely question why. And I have to ask them to show me how they are doing it. The child is not a wafer that will be broken easily. Okay, so we have to do, again, a deep massage. what tools we could use. Okay, if we have a good tool, I would say the gym ball. If we don't have the gym ball available, and especially for people who I would say they don't have access to the gym ball, I would say the rolling pin. The rolling pin can be used. We could wrap a towel around the rolling pin, العجانة, طيب, and then ask the child to lay down in his tummy, and then I will give deep massaging in his back. Why I'm targeting the back? Because there is high number of joints in the back, and since the proprioception located in the joints. So the more I'm targeting the proprioception will perceive those pressure, okay, and then it travels through the spine to the brain. And even thinking about the tactile for them, and again, I will take the sensory stimulation through play. And this is one of the things when I think about the kids. I might be focusing a lot about the children more than thinking about the adults, but I'm sure that in our next slides, I would also highlight about the adults. So for kids, definitely about play and play and play, because since the play help the child enjoy, this is number one. Number two, help them to socialize, help them to develop the sensory skills, help them to develop the physical, the cognitive, and further on. So all of these through play, and even sometimes does not have to be a fancy toy. Sometimes they can create from even the sand. We used to be so happy when we play the sand when we were younger. Expressive art, and here is I would highlight the other day debate about whether you would use the drawing, the art for the kids or even for adults to express their feelings. So there is no right and wrong. Sometimes it depends on the preference of the person that I'm talking to or in the person that I'm dealing with. Some people, they don't like to draw. Okay, I cannot come to them, okay, and would you like to draw? And for them, if they say no, sometimes I will ask them, what do you like to do? And this is one of the basic things that we used to take even in the university, okay, thinking about what the person likes to do. And in addition, also, some of them, they might like to write, some of them like to draw, some of them, they like just to listen, some of them, they like to talk. It's really important, again, that we let it go. Okay, the person has to show it. It's important to know about the history. And again, if it's this in a stage where he is in a depressive stage, okay, and with him to talk in more about what happened to him, it has its positivity and negativity because he is already depressed. So for him to talk about it and making him talk about what happened to him, okay, about the trauma that he came across. With the time, he will start to feel that every time they talk about their feeling, they notice that they start to get used to it. It likes what happens to us whenever we come across any situation through the day and we feel annoyed from that situation. We notice ourselves, we might tell the first person and we were so angry, and then go to the next person and still I'm angry. The next day I tell the third person. I notice that our feelings start to, like the negative feelings start to decrease. Because again, this is the human nature of adaptation. For the brain, when they expose to certain feeling, with the time they get used to it. Some of them, they become stronger. Some of them, again, it depends on what goal do they have. The goal that they are looking forward to it. The role model, I would say, the role model, qudwa, the one that whenever we have this role model, whenever we have a certain goal, when we live, it's really important. It's what makes us moving forward. Even sometimes if we stop and we become depressed, this is expected. We are still human. This is expected. I'm not going to expect anyone to be strong all the time. No one is able to be strong all the time. Even if they are showing it that they are strong all the time, it's kind of, I would say, impossible. Okay, it's high expectation that it's impossible. And again, I'm always thinking about when we look at the rhythm of any heart rate, we see it goes up and down. When we see the when we see the lines of the heartbeats and the pulses, this is what how we, even our feelings, and this is even with the sensory part, there is nothing called straight line for the emotions. So again, when we think about the art, we have to think about the person, if is it suitable or not. It might not be the suitable time for the person, or like it might not be suitable for the individual that I'm treating to ask them about what happened. I might gather from another people about what happens for them to show that I'm understanding what happened. I don't have to ask you now. Okay, and sometimes we could even ask the individual, are you ready to tell me about what happened? How did you feel about it? Okay, but then we have to move. It's really important not just to think about the emotion. How do you feel? It's fine. Okay, what's your expectation of the next? It's really important to think about it. Okay, so because again, this is the life that will continue. It won't stop. Sometimes we feel that it's so harsh, but again, sometimes the harshness makes us stronger and stronger. And here is when what I'm saying about if they are ready to talk. Some kids might, or like even from the therapist, they might create a storytell. They bring something similar with different circumstances, and they have to highlight that this person, different circumstance, and they will be able to achieve. This person able, what would be your achievement? Sometimes they are still in the depressive stage where they feel, I don't care to do anything. Okay, I might give that person, okay, think about it. You might come and change your mind. Okay, again, it's important to give the person a space for them to express their feelings, to express their opinion. It's important. This is one of the things that can be done as a group session, whether between adults and pediatrics, for adults, for pediatrics, the mindfulness and the breathing, because the breathing has been shown really great effects, especially when we oxygenize the body with enough oxygen. They start to feel relaxed, and again, goes to the neurotransmitters. Everything goes to the neurotransmitters. And even with the mindfulness for the pressure, instead of feeling the pressure, the mindfulness make the human body to relax. And this is really needed as a relaxation, because the body is being overwhelmed, that whether mentally or physically being overwhelmed, they have being overstimulated. Those activity again can be done for both adult and for pediatrics. Moving to the amputation rehabilitation, we have to think about the stages of rehabilitation as well, where the beginning of the amputation, there is more of the limb and the wound being so fragile. So we have to give massaging, and for the person to understand that there is no limb, because the brain still understands that the limb is there. And this is, we have experienced in different cases with I would say one of the foot was, or one of the legs below knee amputation. And every time, like for the first 1 week or 2 weeks, the person like had 2 incidents of him trying to stand on his foot, the amputated foot, because the brain still have that information. Okay, and he felt, that individual felt. So the brain still have the information of the amputated limb. So we have to give the tapping, the mirror therapy, the tapping technique towards the amputated limb. We have to think about the wound management until it's become healed, and then we could, after the healing, we started the scar mobilization, desensitization, and again the tapping, the mirror therapy, again for the brain, to update the brain of what's happening in the body. Okay, and then we will go to the stomach shrinker, which is a pressure. It's like more of containment of the limb or amputated limb to save a certain shape. So later on, it will go with the prosthesis fitting and rehabilitation. And one of the greatest thing now with the 3D printing, okay, this is one of the high possibility that could help having different prostheses fitted easily, and it would be cheaper. Okay, and not only when we think about the cheaper, so the access of it. Cheaper, that means it should be with the accessibility, even easier to access it with the time. Okay, so those are, so again, briefly about the stages. I didn't go into details, and I'm more than happy again to provide the booklet or the leaflet about in Arabic, I think. And again, I have it both in Arabic and English, but I have to search in my folders because it was, I believe, 5 years ago or 6 years ago from now. So I'll try to find it and provide it with the team and the group so everyone can have access and understanding of how to deal with the amputation. And the great thing about the rehabilitation of the amputation, we see great changes. We feel even for us ourselves, like as a therapist, that we have achieved. And I'm sure that for any patient or any client, they will feel the success. They will feel the satisfaction. So it's really important about thinking about the amputation rehabilitation. And again, the greatest thing is just thinking about the stages and understanding what to do in each stage. Thinking about the establishment of active routine. Active routine is really important for any human being, especially with whether it's traumatic, with the mentally depressed, mentally ill and anxious person. It's really important about thinking about active routine. When I say active routine, it has to have both movement, cognitive stimulation, relaxation, doing different activity. I might go with even the basic ideals and even thinking about helping others, thinking about doing some sports. So all those that now the components or like the elements and the modality that not a modality, I would say more of the intervention, overall intervention, naming of interventions can be added through the day. And sometimes even letting the individual to participate in what do you want to do through your day. And for me, I might give them some suggestions and I might give them 4 or 5 activity or occupations for them to do through the day, and then for them to add more. And again, we could even grade it. If the person is not motivated, showing lack of initiation, not being motivated, in this case, again, we come to the things or like to the hobbies, to the activity that they like, they prefer. Okay, and sometimes you could use the individuals surrounding them to create social support. Exercise is very important, and this is also another component that can be looked at, that can be participated by both parents or like family, group of friends, adults, and pediatrics, children, different type. So having this group exercise would be really helpful, okay, to create healthier, motivational, and it helps with the improving the brain. And any child who have anxiety, we might ask them to do the exercise of sitting up, for them to lay down in their back and ask them to sit while they are straightening their legs. Okay, that will help improving the abdominal muscles and at the same time minimizing the gather and the gather of the cortisol in the abdominal part. So exercise again, and also I'm more than happy to provide with the evidence about the impact of exercise on the field of well-being and the confidence, the self-esteem, and that again, all of it related to neurotransmitters. Thinking of attachment, and one of the greatest things that I have seen during the time of the war, whenever a child loses his parents and become infant, we see right away adaptation. And this is one of the, I would say, magnificent and great, and if I have more explanation or to describe it, okay, the great feeling of humanity, I would say, the real deep humanity that I was seeing right away. They adapt to that child for them to feel safe, and they create the feeling of attachment. And this is one of the also component that I noticed about the community. The community in Gaza, or I would say even among the Palestinians, it's really, I would say it's teaching a lot, especially nowadays that our social life start to decrease, not as same as before. We used to know the neighbors and the surroundings, that it might be even the whole town. We know the majority of them. Recently, with the busy life, we start to, like our social life start to decrease. And again, it's just like when we see those situations, when we see those videos, again, it's reminding us, reminding the beauty, I would say, of the support, the beauty of attachment, beauty of the strength of the community. And actually, we are learning, despite I know that how it was, I would say, despite the feeling that we were having whenever we see different type of videos, again, it made us learn huge lessons. And I'm seeing that the whole world is changing because of what happened. And again, when we come to culture, and this is one of the greatest things that, again, we should value it, I would say. We must, I'm not going to say we should, we must value it. We have, I would say, a very strong culture. We have the feel of humanity. We have the feeling of, and when I talk about the culture, I'm not talking also just about being Arab or being Muslim. Those two things, I'm always saying now, those two things, being Arab, being Muslim, I should be all the time proud. Okay, and when we think about the knowledge, when we think about whenever we want to dig more in the knowledge, okay, and dig more in the science, okay, we are capable. When we think about the humanity, when we think about the strength, and again, this is one of the components I always inform my the parents because I'm more covering the pediatric therapist. Sometimes if the child starts to cry, they ask me, wouldn't this be traumatizing for the child and that will affect his life? I say we are Middle Eastern. We don't think about just the trauma. We think about how to move on. Okay. And again, when we think about the goal, when we think about there is no end. Okay, the life, again, like the life is stages. Okay, or like we live different stages. Okay, and for us to know that we are living different stages, giving us hope more and more. So again, for me, and again, I don't have to be right or wrong, and it might be a critical point that can be discussed. I'm just expressing my my point of view, okay, about the power of culture, the power of faith, and when we think about the goddess rules, okay, there is, and we should again value it. We must value it. It's goddess. It's not the human who have set this rules. So again, as a culture, it's the power of culture. I have to think about the power of culture. And when I see the community, how close they are with each other, when I look at the community become stronger and stronger, thinking about the hope and thinking about the faith. So as a summary, I have introduced the importance of understanding the stages of the trauma. And it's really important to think about each stage and thinking about and respecting when we deal with different client, respecting the stage that the client is in, to be able to help with the client with valuing, again, to reach to a stage where they have more of well-being. And again, I'm not trying to make everything perfect, but again, we try to improve. We might not reach to the highest level of satisfaction because there are things from our hands cannot be controlled. So, but at least we could help to, or show that we are trying to help. So we could impact, like create that fingerprint in that person's life or even in their emotions. And even additional also each individual would respond differently to the intervention. Some intervention might be suitable for this person. Some intervention might not be suitable to this person. And also again about the power of the community and the power of the culture. I made it just for 1 hour, okay, just to give it briefly about the trauma. And again, I'm more than happy to provide more of scientific evidence-based. But again, I have to consider or to put in my mind that the majority of the evidence might be more of different cultural perspective. But again, we could use, and we have to think about the external validity. Is it applicable in our daily life or not? So that's it from my side. Okay, and if anyone has any question or any query, I'm more than happy to answer. Okay, towards anything that I have said. If you'd like to drop your question, anyway, like any sort of type of question that you would like to ask.
Thank you so much, Zainab, for this informative lecture. I really enjoy it. We have Yara raising her hand. Let me try to allow. Hello, yes, Yara.
Hello. My voice is good, right?
Yeah, we can hear you.
Okay. First of all, I'm Yara from Jordan. Thank you for the information. It's amazing course, really. I have a question. So you talked about the acceptance stage, okay? So we can take an actions or move to the action stage. But if the client refuse to let it go, and we stuck there with the consideration of how the brain's chemical are working. So what we can do in this state? I know it's far away from Gaza's community because they have a strong mindset, but maybe there is I can say someone who refused to let it go, refused to accept what happens to him.
Yeah.
So what we can do in this state?
Okay, this is a really good question. Remember one of the important points. We might not be the magical stick for every single problem. Here we might need to involve the psychologist. I might try, I might create like different expectations. I might use the family, for example. Okay, and sometimes I come to them, okay, you are rejecting this. Give me your idea. What should we do? I'm here to help you. I cannot leave you in this way. Okay. I have to help you. Once you help yourself, okay, once I see you moving, and then you can get rid of me. So it depends on sometimes even in the age for them to understand. So again, if your question, which client you are concentrating, like you are focusing on, would it be adult or adolescents or a child?
I think it depends on the client's
Yes.
age. Yeah.
Absolutely. That's why, like, for me, when I think about, like, this is different, again, this is maybe away from Gaza. When I think about, for example, I have an ADHD adolescent, her age was 12 years of age. She was refusing different type of activity. And then I give her 3 choices or 2 choices. She has to choose one of them.
Okay, so we can give choices.
You could give the choices.
Okay.
Okay. And sometimes, like, again, so it has to be enforced. Sometimes, again, I might increase the assertivity and then decrease it. Why? Just to show them that I will be more strict with more rules, and then no, I'm more flexible. I don't want them to understand my nature of dealing with them. Okay, because some of them they play it smart. They feel that okay, she is so soft. I don't have to listen to her. Okay. Sometimes the majority, if you are assertive, we have to do this. And then once they do it, they will like it.
Yes.
Okay. And sometimes I tell, okay, you try it, okay, once or twice, and then we will see.
Yes. Okay. Thank you.
Great. We have another question from Bushra.
Yeah.
First, thank you, Dr.
Yes.
Zainab. It was a really excited lecture. My question is how to deal with the person who suffer from phantom pain.
Yes, this is usually one of the elements that they suffer with the amputation. And again, it has to be the massaging and the mirror therapy, additionally with the tapping. Why we are doing the tapping? And sometimes because when we do the tapping, we are creating inhibitory of the interoception. The phantom pain that there are messages in traveling to the brain that there is a pain. Once I start to itch or touch the place where I think there is a pain or nearby the place where I feel the person is feeling the pain, the brain start to because there is another touch distracting the brain from those messages. So it will create inhibition towards the phantom pain. So the massaging, deep massaging, the tapping, and the mirror therapy. So those also, I will go back to the amputation management. Those three components will help. And the good thing about the stomach shrinker, and again, if the patient and the wound is healed and the patient is ready for stomach shrinker, also it should show the phantom pain being decreased with the time.
That's great. We have Yara still, you are raising your hand. Do you have any question? Or you just forget? No. Let me see. How we can deal with a client took long in any stage? Should we move slowly with them?
Not really. I wouldn't recommend to be slower. Okay, like for example, with the denial stage, we would say up to 1 month. After the 1 month, that means there is high possibility that might go faster towards the depression. So I wouldn't recommend. Well, again, here is another debate. There is no right or wrong. Some people might say, no, I will give them the time for them to recover. But again, I have to help them faster. I don't want the brain to live for longer time in the negativity and again on the disturbance of the functionality of the brain, the functionality for the production of the neurotransmitter. So again, try to involve other subspecialties such as the psychiatrist or the psychologist, because some intervention might be helpful from them. Although sometimes for us, we don't prefer anyone to suggest any medications because sometimes the medication show or decrease or there is the side effect of them for them to be fatigued and less motivated more. So, but again, it has to be consulted between us and the psychologist, but it shouldn't be for long. Long, that means I'm worried that it becomes chronic. Chronic, that it will continue for further time, longer than expected, and then become harder for us to help them.
Okay, I can see in chat many thanks to you. Yeah, all said thank you so much. And no, any question? Okay, I think we can end by this time. Thank you so much, Dr. Zainab. And hope we have part 2 of this. We want to know more about trauma and the evidence-based that are available to us and how we can adapt it to the culture point of us. Thank you so much.
Thank you to you too.